How you doing? My name is Adam Gargano. Today's topic is going to be on IV setup. So the first thing, everybody has their own little way of doing things. They like to set up IVs. All right, but here I'm going to show you how to set up things the proper way. Now, the first thing you need is your IV solution. You have a 500 bag, 1,000 bag, 250 bag, whatever you need for the patient. All right. Next thing you need is your IV tubing, either 10 or 60 drop set. Here we have a 10 drop set, which is the most commonly used. Um, First thing you do, take the one end, take this little cap off. You're going to plug this in as such. Now fluid will start to come out of the other end. The way you want to do is just drain it. Make sure you get all the air bubbles out. Once you have that done, you just close it off. And usually what you do is you hang this up off to the side and waiting to be used. Now, also you can have your tourniquet. Your tourniquet is used to place on the arm to constrict venous flow. Once you have constricted venous flow in a proper vein, you go ahead and choose one of your IV catheters. IV catheters are going to be from the most common use here, 20 gauge, 18 gauge, but you can also go all the way down to 14 gauge, is the largest, and up to 24 gauge, which is the smallest. But these two are the most common. Once you have your solution set up, your IV catheter of choice, you go ahead and start your IV. Now, one thing you can also do, if you do not want to start an IV bag, saline bag, we have here a medication access port, also known as a MAP, and all it is just screws in like so. And this is so for a patient, it's a stable ALS patient that doesn't necessarily need fluids, but you know the hospital's going to want an IV, and you can go ahead and start this in lieu of the IV solution. So you also have your alcohol prep. You got to clean up the site. And here we have a VenaGuard. Comes off here and goes on top of the catheter itself with the IV catheter hub showing through the actual this little clear plastic here. If you do not have this, you can always use, I used to do, a piece of tape, and you can also cinch down the IV catheter with that if you do not have the VenaGuard. What I also like to have is also some gauze placed underneath the catheter itself. So in case there is some bleeding, blood comes out of the catheter, the hub, this will catch it. This doesn't go all over the floor. So you have your IV solution, you have your tourniquet, you have your IVs of choice. You also have your preps to clean it up. And that is pretty much your IV setup. Thank you.